So let's start with the structures identification. Now, as I told you earlier, we have major muscles and soft tissues. The most common injuries which I would say which happens are the soft tissues, because the knee joint is 100% dependent upon these soft tissues for its maintenance or mobility. Any small trivial injuries can lead to an injury to the soft tissue. So the most commonly injured soft tissue are the side ones, which can happen when you twist your leg somewhere. The other one which is commonly happens is the in-between ligament, which you call the cruciate ligaments, which happens with the fall, likely. Then the severest one of them are the meniscal injuries, which are some sort of washers, as I told you, if in case they are injured. Now the identification of them is better done by the medical professional. He knows how to identify which structure is there. But from a layman point of view, I would say whenever there is an injury of the ligament, always remember that it will depend upon the grade. There are different grades of ligament injuries, 1, 2, 3 and 4 plus. So if in case the amount of injury is more to a ligament, the symptoms will be according to that. But from our point of view, from the initial first aid point of view, what I would say, if in case you feel any sort of a spot which is severely tender on the sides, of course it could be the ligament. If in case you bend the knee and when you press in between, if in case you feel any pain, it could be the ligament. If in case you straighten your knee and press from back, if in case you feel any severe spot of tenderness, it could be a ligament. So this is the identification for the ligaments. If in case you try to move your knee this way or this way and you feel pain, then it could be a ligament. The next thing which can commonly injure is your muscles, the thigh muscles or the hamstring muscle. Quadriceps is very likely to get injured until you really strained yourself too badly. Hamstring is a very commonly injured muscle because hamstring is a muscle which has two attachments. It starts from the hip and it also starts from the thigh bone. So if in case it comes this way and it attaches to the joint below. So any strain on this, either from the hip or from the joint bone itself, can lead to a hamstring pull. So, and generally what happens is like we are people who are always in a slouch position, like we are sitting for a long time and we don't stand properly. So the hamstring is always tight. And most of them have this complaint the hamstring is tight. So if your hamstring is tight, it is very likely that it will get injured when there is sudden pull on that muscle. So that is the reason why hamstrings generally get pulled up or like they get strained whenever there's a small jerk in your day-to-day like activity, like you slip down somewhere, you twist your knee somewhere, or you suddenly have to jump somewhere, then the hamstring gets pulled and they get strained. So the hamstring is the most commonly muscle. So if in case you want to find out that, you can ask a person to bend his knee and just avoid the movement. That is, you're putting strain on the muscle. If in case it's painful, that means the muscle has got injured. Ask the patient to bend the knee and then ask him to straighten the knee and see by giving a resistance whether the pain is generating. If that is happening, then it could be the muscle of the thigh which is strained. Other commonly problem is if in case there is some sort of a tightness in the side muscles, then you might feel pain somewhere in the center or you might feel pain in the side. It could be because of the muscle which is on the sides which is tight. If in case, like for example, in people who are doing a lot of exercises or people who are doing some sort of a cardiac activity or aerobic activity, they might at times strain themselves, which will not be present that particular moment, but like after 6 hours or 12 hours, they might start developing some pain somewhere around the knee joint, which will not be very localized. If in case something of that sort is happening, then it could be a pain in these muscles. Next most commonly problem is the pain around the knee joint or the patella. Okay, as I said earlier, patella or the kneecap has to track. It has got like a railway track, it has got a track on which it has to travel. If in case it goes out of it, it will injure. If in case it's going out of the track, that means there's something which is tight on the sides or in the center which is pulling it away. So we need to check that. And then if in case that is happening, what will happen is like to prevent the patella from rubbing along with the bone, God has given something which is called as a bursae. Now what is a bursae? It is like a small jelly-like structure which is present in multiple forms, in up, down, sideways, below, everywhere on the knee joint, just to prevent any sort of undue friction. But if in case you're performing some activity in such a way that you're straining that particular bursae, then there could be some sort of swelling happening there. This could mimic a ligament injury. But the only difference is like you will find a swelling which is like a spongy ball. It will go and it will come up. It will go and it will come up. But if in case there is something which is happening, which is in case of a ligament joint, then you will feel the pain which is very severe and the swelling will not be so boggy. Okay, so that's how you can differentiate, but let it be there with the medical profession, let them take that decision. So it's just for you to decide about that. Next most commonly problem which we are seeing is degeneration or the arthritis of the knee joint, which is very common in patients above 40-45 years. Now what is the reason behind it? Remember the burger thing? So any sort of untoward pull on any side of the muscle could track the lower portion of the bone on either sides. If this is how you are walking, then it's very likely chances that you're going to strain this part of the knee. If this is how your knee is when you're standing, then it's very likely that this is going to strain. We don't realize it until the pain comes out. So the most important thing is like we need to work and see what is happening. So if in case I see a knee joint on an x-ray and find out there's degeneration or the space is reduced, it could be possible that your structure somewhere below is tight and that is pulling it here and causing this degeneration or the space to be reduced. If in case we correct this, it can be corrected. So generally when we talk about a knee replacement or a knee surgery, we talk as a treatment for this, can be avoided if in case we assess the knee joint, take into consideration the hip and the ankle also. If in case we go localized, we might do a wrong diagnosis. Is always important. Then if in case we're talking about the knee, we need to look at the structure above and also the structure below the knee joint. Okay, so that is in comparison to the degenerative problems which we generally face in these joint. So I think I wrapped up almost all the structures around the knee joint. If in case you have any queries or any comments, do let me know in the comment box. I'll get back to you. The next thing which you're going to see is about the treatment which we'll have to give if in case there is any sort of injuries in this particular knee joint. Okay, so let's look at the various treatment options which we have and like how to give the first aid for any structures around the knee. So we saw the most commonly seen problems are the soft tissue injuries, and soft tissue injuries, the treatment is always starting with RICE: rest, ice, compression, elevation. So we need to see how much of the pain or problem is. Like if in case the pain is very severe, there's a lot of swelling around, then it needs to be properly fixed. The compression and the support which is required is more. If in case not, then you need not give much. So that the first aid will depend upon how much of support needs to be given. That is the most important point to be discussed. And it depends upon how you are supposed to ambulate or move the patient from that particular location to the next location. The most important thing. So what is the most important thing is like soft tissue injuries. So you know it could be on any of the sides. If in case you find it's painful, its redness is there's a lot of swelling around, and you know the patient not able to move, then of course we start as an immediate thing is ice. After 5 to 7 minutes of ice, you need to give a support or a compression. Compression can be in the form of the compression bandage or it could be a form of a splint. Now a splint has to be given or not. If in case the person is not able to weight bear, he is not able to stand, then you need to give a proper support which has to be in such a way that it should not allow even a minimum movement in the knee joint. If in case he is able to stand, he is able to weight bear, then you can go for various sort of a simple support like a compression bandage, or if in case you've got a soft elastic kneecap or something, you can make the patient wear and move around. But if in case the pain is severe and he is not able to weight bear, then it is better that you don't encourage the patient to weight bear. If in case he has to walk, he can take the support of somebody, not putting weight on the particular leg. He can use a crutch or a walker, or he can just not move. That's the best. Or you can use a wheelchair, which is much more better, because the more you put weight on the particular joint, the more likely the injury is going to increase. So that's the most important thing. Second thing, if in case we need to understand its spasms or muscle tightness, which happens mostly in degenerative patients, like you have got an arthritic problem, they might feel at times the joint getting fixed, stiffness coming up, not able to move. Early morning when you get up, you find it's not really comfortable moving. So if in case those are the complaints, then it's always better to give some hot fermentation. So again, my recommendation is like you can give it 4 or 3 times a day. I think if in case you're giving, it should be done after every 4 hours, that is like morning, afternoon, evening and night. If in case it's going to be a hot fermentation, the morning, afternoon and night. Especially when you're doing a hot fermentation, be very careful that it should not be too hot. It should be something which is like soothing, which is comfortable for the skin. Because you're going to keep it 3 or 4 times in a day, it should not be too hot because it is likely to injure your skin. Second, the what kind of heating pad you are supposed to, you can use either heating pad, you can heating gel, you can heat a heating bottle, or even you can take a towel, dip it in water, hot water, squeeze the water out and keep you can do any of those things. The best which I feel and I recommend is the one which you can dip the towel in water and squeeze it out and use it. Otherwise, any of these will go. But whatever you're using, always be careful that you're not using too much of heat. That's the most important thing, and always cover the part with a cloth before you apply any of those stuff. Okay. Now the support which you need to give will also depend upon the kind of splint which you have. If in case you don't have anything to move, then of course keep some sort of a stick or something on either side and see to that the joint is not moving. So that is the most important first aid which you will have to give whenever there is a problem. And always check if in case there is some pain in the hip or in the ankle also when a knee is injured, because likely chances that when the knee is injured there could be a secondary injury in the joint above or below, or the knee joint could be a secondary injury to a major injury in the ankle or hip. So always you need to check on either ways. That's very important for you to differentiate and find out what is the first aid which has to be given for these patients of yours. Again, as I said, always wait for 24 hours to 48 hours to see the symptoms are coming down or not. If in case not coming down, you need to check with your healthcare professional wherever you are. Okay. So next we are going to see what are the different exercises which can be performed in the knee joint. We'll start with the basics and then we'll try to make it as tough as possible. I'm not talking about the athlete level, but I'm just talking about the normal layman level, like how much we can go about it. Okay.